Hello, my name is Scott Richardson, and I'm a doctor of acupuncture and oriental medicine. Now, some people, when they go on the website, they'll see something referred to as injection therapy or AcuPoint injection therapy, and they don't really know what that means. So I want to take a second and explain what exactly that is. As a licensed acupuncturist, we have the ability to do injections. Now, there are specific substances that we can inject and specific ones that we cannot. We can inject, and it's usually natural medicines, vitamins, minerals, dextrose or sugar is another one that we use. We're also allowed to use an analgesic or a numbing agent with our injections, usually something like lidocaine or procaine. And so that's something that we can do in our treatments to help people feel better and to improve. How that differs from acupuncture. A lot of times I find it as an additional benefit or something that improves upon acupuncture. Many of the locations that we're using are those traditional acupuncture points, and we're just using the medicine, the substance that we're injecting to have an added effect than just stimulating the acupuncture point itself. There is a study that came out of North Carolina University. There is a physician that was treating rats with a substance to try to relieve back pain, and they're having difficulty because when they were trying to inject the medicine by the spine, they were actually having problems with actually hitting the nerve and causing damage. Now, as a physician, he had no training in acupuncture, but he decided to try one of the acupuncture points for relieving back pain. It's a point that's located behind the knee. Acupuncturists know it as UB40. What the physician found in his study was that he was having much better results by using this point behind the knee with the back pain in the rats. In fact, he later went on to study that a little bit further, and he concluded that AcuPoint injection therapy can be as much as 100 times more effective than just acupuncture alone. Now again, based on what it is that we're treating, there are different approaches and different techniques that can be used. Biopuncture is one that has been referred to a number of times that uses homeopathic substances. It was featured on Dr. Oz as an effective way to treat and eliminate pain. There's also a procedure called neural therapy that uses analgesics like lidocaine and procaine around scar tissue, and especially for chronic conditions that can be extremely effective. Acuprolo or prolotherapy, where we're using sugar water to stimulate an inflammatory response to heal tendinitis and tendinosis, works great for chronic injuries and inflammations of the tendons and ligaments. And so there are a number of different approaches that we can use, and based on what we're doing, where we're injecting, that's going to kind of determine the name that we're using or what it is. But if you have any other questions about AcuPoint injection therapy or the services that we offer here, you can email me through the website. Again, I appreciate your time and have a great day.